Hi everyone, this is Dr. Prityavari. Today we will see nerve supply of urinary bladder with clinical significance. Bladder is innervated by a vesical plexus of nerves which is made up of fibers derived from a plexus called as inferior hypogastric plexus. So in the pelvic cavity there will be a plexus called as inferior hypogastric plexus and few fibers derived from this plexus will form a small plexus in close vicinity, or let us say in the wall of urinary bladder, called as vesical plexus. And that plexus gives rise to various kind of nerves which will supply to the bladder wall and the sphincters of the urinary bladder and urethra. Now, what is there in this plexus? This plexus is made up of two components of autonomic nervous system, sympathetic and parasympathetic, having both afferent and efferent components. Afferents means sensory fibers, efferent means motor fibers. And these fibers are actually controlling the micturition. Micturition is a reflex action involving a reflex arc. The afferent and efferent limbs of this arc are basically formed by parasympathetic component of nervous system with a lower micturition center at sacral spinal segment 2, 3, 4. So we have to see the efferent and afferent components of this reflex arc now. Now this reflex arc with the lower micturition center will be controlled by higher centers in the brain with the help of motor neurons, which are upper motor neurons of pyramidal tract. Now a sympathetic component is also present which greatly acts on the sphincters. This is derived from thoracic spinal segment 10, 11, 12 and lumbar spinal segments 1 and 2. So there will be both sympathetic and parasympathetic components which will supply to various parts of the urinary bladder, and these two together will control micturition. This is a beautiful picture which is showing all the components together. Let me explain you this diagram. Now on the right side you can see the spinal cord with the sacral 2, 3, 4 segments highlighted, and in the center this green colored is the urinary bladder. The muscle of the bladder wall is called as detrusor muscle. You can see these spinal segment S2, 3, 4. They are giving rise to fibers which are shown with green colored. So these are the spinal nerves coming out. Their branches come together and they form a plexus, that is vesical plexus. I haven't named this plexus because it would have been too crowded. So you can see a plexus, and from that plexus, nerves come out. These nerves are the pelvic splanchnic nerves. The pelvic splanchnic nerves, these pelvic splanchnic nerves, they are innervating to the detrusor muscle of bladder wall. They are activating this muscle, so they are actually excitatory. That means they will do contraction of this detrusor muscle. So what is the action of this what is the action of these parasympathetic fibers? These parasympathetic fibers coming from S2, 3, 4 segments, they will give rise to pelvic splanchnic nerve, which will do contraction of the detrusor muscle. That will lead to micturition. What else can parasympathetic do? Now in this diagram, I have only shown the efferent component, that is a motor component. But back fibers coming from the bladder wall are also entering inside the spinal cord, going to same segments. These are called as afferent fibers. The afferent parasympathetic fibers or sensory fibers will carry pain sensation and sense of distension and filling of the urinary bladder. This is also very important to understand. So I just showed you one component here, that is parasympathetic component. So you need to make it fixed in your head that whenever parasympathetic is activated, like pelvic splanchnic nerves, what will they do? They will help in contraction of the bladder wall muscle. So it helps in emptying of the bladder, that is micturition. Now, what is the function of sympathetic component here? So on the left side, you can see shown with the pink color. You can see there are spinal segments T10, 11, 12, L1, 2. From here, the nerves are coming out. These are the sympathetic nerves. And these nerves, as they go down in the abdomen and in the pelvic region, they will be forming a plexus. Again, this will be a inferior hypogastric plexus. Then it will give rise to vesical plexus. Even though two plexuses are shown on two sides, this is just for the sake of understanding. This is only one plexus shown on both sides. So again, this is a vesical plexus near to the urinary bladder or within the urinary bladder. And from here, a nerve is coming out, and this nerve, it's not labeled nerve actually. And what will it supply? It is going to supply to the sphincter vesicae, the lowermost fibers of the urinary bladder, which are forming sphincters at the upper opening of the urethra, the pre-prostatic part of the urethra, you can say. And these sphincters are activated by these sympathetic fibers. What does it mean? These fibers will contract. So, what can happen? The internal urethral opening will be closed here. So, when this opening is closed, then there will be relaxation of the detrusor muscle. There will be storage of urine. So, sympathetic will help in collection of the urine in urinary bladder. So, again, you have to make it clear in your head, in your mind, that sympathetic fibers, what will they do? They are going to help in contraction of the sphincter vesicae. These internal urethral sphincters are also called as sphincter vesicae. And when these are contracting, the detrusor will relax and it will help in collection of the urine in urinary bladder. So again, make it sure that you know that parasympathetic helps in micturition, that is emptying of the urinary bladder. Sympathetic component helps in collection of the urine in the urinary bladder. Now, what is the function of these blue colored somatic fibers? Now, these somatic fibers, these are the fibers which are supplying to the skeletal muscle. Which skeletal muscle is here? The sphincter urethrae, which is present. It's a part of urogenital diaphragm and it is present around the external urethral opening. In females, you can say. In males, it will be present in the urogenital diaphragm, this part of the urethra, membranous part of the urethra. So this is called as sphincter urethrae. It is a skeletal muscle supplied by pudendal nerve. This pudendal nerve is coming again from same segment as 2, 3, 4. But this is a somatic nerve. It is innervating to the skeletal muscle. So what will it do? This will help in contraction of sphincter urethrae. What will it do? It will help in voluntarily controlling the micturition. So with the will we can control micturition. Now when is this seen? Let us say a small child is going in a garden with mother, and the baby is saying that, "Mother, I feel like micturating. I feel like voiding the urine." So what the mother will say? Mother will say, hold on for some time. Let me find some suitable place, or let me find the washroom. Then you can go in the loop. So that time the baby is trying to hold the urine. What is it? This is voluntarily controlling the micturition. Even though the internal opening is open, the sphincter vesicae are open, but sphincter urethrae are closed. That helps in voluntary controlling micturition. That is the significance of this somatic component. I hope you understood. The green color is signifying the parasympathetic part and related muscle of the urinary bladder. Pink is showing the sympathetic part and the related muscle of the urinary bladder. And blue is showing the somatic component and the muscle of the urethra innervated by that. I hope you understood this beautiful diagram. The same thing is shown in the tabulated format. You can read yourself. Now, why we are learning so much about the nerve supply of urinary bladder? Because any lesion involving in the or involved in the innervation mechanism of the urinary bladder can lead to Neurogenic bladder. The neurogenic bladder lacks the normal neural control of micturition. And there are three types of this kind of bladder: atonic bladder, automatic reflex bladder, autonomous bladder. What is atonic bladder? This kind of bladder is seen in the phase of spinal shock immediately following injury to the spinal cord. It may last from a few days to several weeks. What is it? Why we call it as atonic? Which muscle is not having tone here? This is the muscle of the bladder wall. The detrusor has lost its tone. It is atonic. And in contrary, the sphincter vasicae, internal urethral sphincter, is tightly contracted. The bladder wall muscle is loose and the sphincter, which is present at the opening, is closed. So, what will be there? There will be collection of the urine. The bladder muscle is not able to understand whether the urinary bladder is filled or not, and the bladder is expanding in size. The bladder becomes greatly distended and finally it overflows. There is no voluntary control on micturition. There will be overflow, incontinence. Because of overflow, the bladder capacity is utilized more than expected. So bladder has to evacuate. This is called as overflow incontinence. So in atonic bladder, we can see overflow incontinence. I hope you understood. This is seen in immediately after the injury to the spinal cord in the phase called as spinal shock. Now what happens? After this, the second phase is automatic reflex bladder. Now, here the patient has recovered from the spinal shock. Now, where is the injury here exactly? Here, the injury or complete transection of the spinal cord will be seen, which will involve upper motor neurons, that is, pyramidal tract or corticospinal tract, present above the micturition center. We all know micturition center is present in the sacral region. So, above the sacral segment, if there is injury to the spinal cord and the patient has recovered from spinal shock, then what we can see is automatic reflex bladder. The patient has recovered from spinal shock. That means the lower micturition center is still intact and the bladder is functioning as the reflex arc involved in micturition is intact here. As the bladder fills, the stretch receptors in the bladder wall are activated. The afferent nerve fibers will carry this message till the lower micturition center. The efferent nerve fibers, the motor fibers, those are pelvic splanchnic nerves. They will carry message to the detrusor muscle to contract. So the bladder wall muscle will contract reflexly in reaction to the stretch receptors activated. What happens here? Along with that, the sphincter vasicae and external urethral sphincters are relaxed and then the bladder will be emptied. This is seen every 1 to 4 hourly where the bladder will empty reflexly. There is no voluntary control on micturition. So bladder is acting automatically as if it is being automated. The reflex arc is intact. So whenever the stretch receptors in the bladder wall are activated, the signal will go to the lower micturition center and lower micturition center will send the signal to the bladder wall muscle detrusor to contract and the sphincter vasicae and urethral sphincter to relax. There is no voluntary control on micturition. This is automatic reflex bladder. Next is autonomous bladder. What is it? When will it happen? It results from destruction of spinal segment S2, 3, 4 of spinal cord. The lower centers of micturition are destroyed. That means there is no afferent, no efferent, no reflex arc. The reflex arc and the voluntary control over micturition is lost as reflex arc is interrupted. That means the pelvic splanchnic nerves are not functioning here. Then the lower motor neuron is not functioning, so the bladder wall becomes flaccid. The capacity of the bladder is greatly increased. Bladder fills to its capacity and overflows, and there will be continuous dribbling micturition. Continuously, the urine is dribbling out. This is not overflow incontinence. That is different. That is, after the bladder overflows, there will be micturition. Here, what is happening? As the bladder wall muscle is flaccid, there will be continuous dribbling of micturition. There is no voluntary control on micturition. Here, the bladder may be emptied by manual compression of anterior abdominal wall muscle. But the infection of urine and back pressure effect on the ureter and kidney are quite commonly seen in autonomous bladder. The differences between them are shown in this table. You can go through them. I hope you understood the topic. Thank you for watching. Please do subscribe, share, and like. Thank you.